talking about changing the culture of pain care. So people are thinking less in terms of, I have pain, what can you give me to get rid of it, to, I have pain, it's interfering with my life, what can we do to improve the quality of my life?
The healthcare industry is currently undergoing a cultural shift in the way that it views and approaches chronic pain care. Healthcare professionals have discovered that acute pain and chronic pain differ in their nature and in what is required to treat them effectively. This discovery has led to the recognition that good chronic pain care is comprised of 6 essential elements.
The most important of these 6 essential elements is educating the patient, because unless you start with that, everything else won't follow through. So if the patient doesn't understand what we're trying to accomplish together, the care plan cannot be carried out. The family needs to understand what we're trying to accomplish together. And this education, this first essential element, educating the patient, it's also educating the family.
So my experience actually started in a little bit more active way. My primary care physician encouraged me to try some, non-medication type of treatments to subdue my pain and really try and help manage my daily lifestyle. So that included things like working out, working with a physical therapist, trying to just be more active, also eating healthy, and trying to get a good night's sleep were things that. So there's a lot of strategies and different ways we can look at educating the patient population while still ensuring that the information is disseminated clearly, accurately, and in a way that meets the service member or veteran's needs.
It is essential to include the patient in all decisions related to their pain care. Empowering the patient through the promotion of self-care and providing self-management sets the stage for patients to assume ownership of their personal pain care plan.
They say that 80% of pain is actually managed by teams in the primary care setting. That could be nurses, that could be nurse practitioners, that could be physician assistants, social workers, mental health providers. We all are impacted by patients presenting with pain.
Pain care, again, is not about a bunch of different providers doing different things to or for a patient. It's about a team of individuals working together with someone that has chronic pain. And the team has to be on the same page. So what we're trying to do now is change the culture of how we, as different disciplines, approach pain care together. So the second essential element is training the team of individuals, or in a sense, changing the culture of pain care.
Safe and effective pain care requires good communication and ongoing collaboration between all members of the patient's healthcare team. Chronic pain care requires a team that is closely connected with the patient and team members that are highly integrated in support of the patient's care plan.
The third thing is not to start by thinking about medications and procedures, but to start by thinking about self-care, self-management. What is the person's own potentials in terms of what they can do to reduce their pain threshold and make sure that they're doing all that they can do themselves. We're certainly looking more at integrative health or integrative medicine approaches like acupuncture and mindfulness and yoga and other somatic approaches. So that's the third essential element, is not jumping to medications and interventions, but looking at self-care, self-management.
So between Tai Chi, acupuncture, yoga, ultrasound, and other chiropractic practices, between all of those things, ever since 2009, I have not had to take one prescribed pain pill for any particular reason.
More and more we realize that you have to keep moving. The evidence is clear. So helping veterans find a practice that fits them and their lives is so important. And we're trying to bring these approaches, like Tai Chi is a wonderful movement practice that also incorporates mindfulness. And mindfulness has been shown to be a very important approach in dealing with any chronic disease.
It is important to emphasize non-pharmacological approaches with a primary goal of improving the patient's overall functioning in life, as opposed to focusing simply upon reducing the patient's pain scores. In this way, patients can take control of the ways they self-manage their chronic pain, including being physically active in a variety of creative ways.
One of the game changers for us in VA was the IMED consent process. For years, we've been using paper opioid contracts to explain to a patient what the risks and benefits of taking opioids are.
iMed Consent standardizes the education and consent process for patients and their families around long-term opioid use. This assures that every patient taking opioids is aware of the risks involved and the process of regulating safe opioid use. In addition, the Taking Opioids Responsibly document, as part of the iMed Consent process, outlines effective non-pharmacological and alternative pharmacological approaches to chronic pain.
If you're going to use interventions or opioids, make sure you use what we call universal precautions. It's a diagnosis that clearly calls for opioids, that you use informed consent, that you educate the patient, that you do urine drug screens. You have all of these structures in place to make sure that if you use opioids, you use them safely.
Another important tool to support this element is the use of regular urine testing. This enables verification that the patient is taking the medications that are prescribed, like opioids, and ensures they are not taking additional medications that could have adverse interactions with the prescribed opioids.
One of the really exciting things these days in medicine is we have many ways of bringing specialty care expertise to the patient. Instead of thinking about sending a patient to a specialist someplace, we can bring specialty expertise onto the team by telehealth or scan echo video training or e-consultations or even phone calls. And so we can put a team together virtually.
Technology today is enabling healthcare teams to communicate more effectively, whether they are co-located in the same facility or across the country or globe. This enables a healthcare team to connect and collaborate with specialists who would otherwise be unavailable.
Are you measuring what you're doing? Just like you would do with diabetes or hypertension or any other health issue, chronic care management involves keeping track of what you're doing. Are things improving? Are they getting worse? Are you measuring that? And can you respond to any changes that are occurring?
Our best measure of how a patient is doing can be illustrated by what they are able to do functionally.
I think patients who are dealing with chronic pain really need to have a plan to not only set objectives and goals, but also to measure progress, right? So when we're looking at milestones, and we're looking at the future of the care for that individual, we have to be able to benchmark and say, hey, we were here and now we're here. That's going to do a couple things. First, that's going to give the patient some emotional stability to know that, hey, they are making progress, or to have a really difficult conversation between the patient and provider to say, hey, you really didn't make the progress that we needed you to. What's going on? And then that'll really stimulate not only a productive conversation, but also it'll give insight into the patient's self-management strategy. Another thing that's really important about managing in monitoring these goals or objectives is to ensure that as we step up in our self-management or in the provider's care plan, we're also able to step down on a lot of these rather invasive techniques. But these are all working in conjunction with a more comprehensive plan that has a goal and a timeline associated with that.
I really would encourage them to look at the bigger picture. They've had patients who they've had on chronic opioids for years. Have they gotten better? Are their lives better? Think about that. Think about these specific patients. And then come and hear stories about patients who successfully manage their lives in a different way.
It's so human to have pain. And it's so human when we have pain to want it to go away. And we all realize that sometimes we have pain that won't go away. One of the really exciting things going on these days in pain care is that we're focusing on individuals who have chronic pain as part of their lives and figuring out how do we best support them when we can't make the pain go away. So essentially what we're saying is if you have these 6 elements of pain care in place and you're doing a reasonable job or a good job with them, then you are going to have good pain care.